Hello everyone and welcome to our part 3 of our series on writing in nursing. Today we move from documenting what has happened to planning what will happen. We will focus on constructing clear, effective and professional nursing care plan and on NCP, this is again in English. By the end of this session, you will understand why nursing care plans are vital, how they connect to the nursing process, and be able to identify and write each key part, from diagnosis to evaluation. Use standard form and clear English, culminating in a practical case study exercise. In our last session, we focused on nurse's note, recording our observation and actions. Today, we will take that information two steps further. We will use our assessment data as the fundamental for building nursing care plans, which act as our roadmap to guide patient care effectively. So, what exactly is nursing care plan? It's a structured, written plan that organizes information about patients. Its main goals are to ensure everyone provides consistent, continuous care tailored to that specific patient. It is a critical tool for communication and planning, and it is built upon the nursing process. The nursing process, ADPIE, is a framework for our nursing care plan. Assessment provides the data. Diagnosis identifies the key problems. Planning sets our goals and interventions. Implementation is carrying out those interventions. And evaluation tells us if our plan works. The nursing care plan documents the ADPIE steps. A standard nursing care plan typically has these 6 key components. We start with our assessment data. Formulate a nursing diagnosis. Set a measurable goal. List our intervention. Explain the rationale for those interventions. And finally, evaluate the outcome. As we revise time, assessment involves collecting both subjective and objective data. This information isn't just for the notes. It's the critical foundation, the evidence upon which we build our entire care plan, starting with the diagnosis. Next, we make a nursing diagnosis. This isn't the medical disease. It is our clinical judgment about how the patient is responding to the disease or situation. We use standardized language, often from NANDA, and frequently use the PES format to write it. The PES format helps us write a complete diagnosis. P is the problem, the NANDA label. E is the etiology or cause linked by related to, and S is the signs and symptoms. Our evidence linked by as evidenced by. This structure makes the diagnosis clear and justifiable. Let's try it. Here's some assessment data. What nursing diagnosis could you write using the PES format? Okay, let's see the data. A 70-year-old patient eats only 30% of meals states, "I have no appetite." That he has lost 3 kilos in 1 week. Skin is dry, throat is sore. Your child is using NANDA-I, write a possible PES statement. Okay, we can give a hint of HANDA label. They got like imbalanced nutrition, less than body requirements, deficient fluid volume. Okay, let's see this. This good answer might be imbalanced nutrition, less than body requirement, related to decreased appetite, as evidenced by eating 30% of meal and weight loss of 3 kilograms in 1 week. See, this is a very good PES. Our next step is setting goals. This must be patient-centered as SMART. Okay, we set the SMART goal. SMART is including specific, measurable, achievable, relevant, and time-bound. A SMART goal gives us a clear target to aim for and a way to know if we have success. For example, in this slide, patients will demonstrate effective coughing technique and clear lung sounds by the end of the shift. Say they have about the SMART. Okay, the specific can measure. They can measure. Achievable, relevant, okay, and time-bound. They say that by the end of the shift. It's very clear. Now, let's practice writing a goal based on this based on this acute pain diagnosis. What would be a good SMART short-term goal? Acute pain related to surgical incision. AEB patient rating pain 8 out of 10 and glimpsing. An example would be patient will report pain level of 3 out of 10 or less within 1 hour after receiving pain medication. Is it specific? Yes. Measurable? Yes. 3 out of 10. Achievable? Yes. Relevant? Yes. Time-bound? Yes. It's 1 hour. Interventions are the actions we take. They need to be very specific so anyone can follow them. They can be independent nursing actions, orders from a doctor, or things we do together with all the healthcare team members. For every intervention, we need a rationale. This explains the scientific or evidence-based reason why we are doing this. It shows we aren't just following orders, but understanding the purpose behind our actions. It often starts with "to" followed by the reason. For example, for assessing pain, "to" establish a baseline and evaluate effectiveness of intervention. Example for administering the morphine to relieve pain and then put on. Okay, let's link intervention and rationale. If our goal is a clear airway, what are 2 things we could do and why? One, encourage deep breathing and coughing every 2 hours. Rationale, to mobilize secretions and improve lung expansion. 2. Suction oropharynx PRN. Rationale, to remove secretion the patient cannot clear independently. Finally, we evaluate. We check if the patient achieved the goal using specific evidence. We state if the goal was met, partially met, or not met. This tells us whether we need to continue the plan, change it, or if the problem is resolved. For example, like on this slide, you have to have a very clear goal first, and then you can do the good evaluation. Now, let's apply everything to a case. Meet Mr. Somchai. Here is his situation and initial assessment data. We will use this to build a part of his nursing care plan. Okay, let's read through this slide. Okay, finish. We will continue. Our task, your task, now is to take Mrs. Somchai's case and build one complete nursing care plan treat. Focus on the NANDA label, ineffective airway clearance. Write the full PES, a SMART goal, 3 interventions with rationale, and how you evaluate, work in group, and use your English nursing terminology. And then do not forget to send me to submit this task into our online course. Okay, here is one possible way to complete the care plan for Mr. Somchai. Compare it with your group's work. Did you identify similar points? Is your English is clear and specific? Notice how each part logically flows from the previous one. This is just one example that can be other correct intervention tool. Okay, I put in the form of the table so it is easy to see and more understand. To wrap up, nursing care plans are our essential tools for planning and delivering high-quality, individualized care. They are built on the nursing process, writing clear PES statements, SMART goals, and providing evidence-based rationale. In professional English is a skill you must develop. Thank you for your hard work today. There are any questions? Okay then, so see you for the next session.